Go 5.
Welcome back. Time now for Health Watch. You may think that when you're in your 20s, you don't have to worry about heart disease, but that is not always the case.
Shelley Botan tells us why it is very important for people to listen when their bodies are telling them something just is not right.
Dr. Alex Roitstein at Aurora BayCare Medical Center says it's also important that you know the symptoms of heart disease before your heart attacks. Candace Everetts listened to what her body was telling her and feels lucky to be alive. One of Candace Everett's biggest joys is her son.
He's almost 2 years old, and he follows me absolutely everywhere.
Candace feels lucky she's still around for him. 3 months ago, she started having problems while exercising.
Most of it was chest pain, and I'd start sweating, and I just not feel generally good at all.
And even though she was only 27,
my dad had died when I was 38 years old of a heart attack, so I wanted to go in and get checked out.
Candace went to the emergency room.
The first doctor, actually, I went to the ER with the chest pain, and they said I was too young.
But because of her family history, Candace was sent to her physician's assistant, who then sent her to Dr. Alex Roitstein, a cardiovascular and thoracic surgeon at Aurora BayCare Medical Center.
This is relatively unique. It's literally less than one person per thousand.
Candace had a congenital heart defect.
They found that I had the growth in the wrong area.
And because of the abnormal configuration of the blood vessels of our heart, when she would strain and exert herself, the blood vessel would kink.
Candace needed heart bypass surgery.
And in her case, we bypassed it with an internal mammary artery.
I was more into shock because it was 3 days before my birthday, and I didn't even think a 27-year-old would be having bypass surgery.
Dr. Roitstein says no matter what your age, you should listen to your body. There are warning signs of heart disease, including chest and jaw pain, frequent belching, and severe indigestion that doesn't go away with medicine.
An ability to do things that you were able to do 3 months ago, just going up and down stairs or go across the parking lot.
Candace listened to her body and went to the specialist at Aurora BayCare and believes it saved her life.
I get to go back to work in 2 weeks, and that makes me happy.
Dr. Roitstein says if you are experiencing any of those symptoms, you should go to your doctor right away.
And to learn more about Aurora BayCare Heart, Lung, and Vascular Center, call 1-866-938-0035 or email healthwatch@aurorabaycare.com.